Well, hello. Welcome to Lynette's Beauty Box via my hospital room. I was going to put my eyebrows on, but I ate dinner and late, and I didn't feel very whoopee. So I got COVID, and at the same time, they found a basically like a gallstone in my liver duct. So basically, I have a stone in my uh, biliary duct. Hang on. I have a tube. Yes, the biliary. It's a biliary drain. I could be saying that wrong, but I don't know. Anyway, so yeah, um, I was transferred from Springfield to St. Louis via a helicopter. For most of you who know, I'm afraid of heights and I don't fly ever. But I was so sick that it was something that needed to be done. So I put on my big girl panties and they shoved me in that helicopter, which was like a can of sardines actually, and put these headphones over my head so I could talk to the nurses because you can't really hear anything in the helicopter. And got me down here. I was admitted into ICU. Um, a lot of pain. They did a lot of tests. And it turns out that my body had gone septic. So I was very sick. And to fix the problem, normally they would go down your throat through your stomach and just extract the stone or whatnot. But because I've had the gastric bypass surgery and my anatomy is no longer like a normal person's anatomy, they couldn't do it that way. So they went in through my side. It felt like they were drilling a hole in me. No, I was not out for this procedure. I was totally awake and being very vocal about how much it was hurting. So they got that in, and it was like dark, almost black, the stuff that they were draining out, and then blood for about 16 hours. And then it started, getting more clear, but it was hurting a lot. Um, I was on, they had put a pain pump on me. And I was pushing that button every 10 minutes that I could. So then what happened was, so the pain was elevated. Thank you. And so they had to go back in and replace the drainage tube, which was sore anyway, but um, okay. So that's what's going on with that. And now we're just trying to get my pain. Oh, fuck.
That hurt.
A little, yeah.
Does it still hurt?
No.
Okay.
Is that just initial push through?
Okay.
I'm getting my tube flushed. Sorry, I don't normally use that cuss word on my channel.
There you go, hon.
Thank you.
You're welcome.
So basically, that's where we're at. I wasn't able to have, when I inserted the tube, it's to drain all the infection out. I've been on antibiotics and muscle relaxer, pain meds. Well, like I said, they couldn't take out that, oh shit, it's gonna hurt. They couldn't take out the stone that's blocking my liver duct. So I have to wait until next month, almost a month, but because that infection has to clear before they can go in and take it out. Apparently, there's a lot of infection. So my life was in danger, all because I was being stubborn. And I should have remembered what Marty had said, that Dr. Eckhouse had said. If you have problems with your stomach, you need to have them transfer you to St. Louis because so we can take care of it. And I was just like, well, I can't get to St. Louis, so. And then I was discharged from the hospital once. When I went back, that is when they were like, okay, who's your doctor? Who's your surgeon in St. Louis? And um, so I let him know because I was having a hard time remembering what her name was, and I can guarantee you one thing: I'll never forget it again. It's like it's etched in my brain now. Reach for the knife spoon thing. The coffee isn't like, coffee house coffee, but it does it the trick. I've had really good luck. All the nurses and staff has been really sweet to me. Today I finally got off COVID precautions. I was actually able to leave my room and walk in the hall a little bit. That was super exciting. I was totally jazzed about it. Oh, I should have put sugar in that. That's gross. And I was fortunate enough to where all the doctors involved in my care got like right to the meat of the whole situation and have been doing everything they possibly can to help me get better, which I really appreciate because, I mean, let's face facts, no one likes to be in the hospital, especially not me. I was in ICU in Springfield, and that was probably one of the hardest things for me because I had COVID. I was on the COVID floor where Marty passed away. Mercy. And it just so happens that I was in the same room he passed away in ICU. So that was very traumatic for me. But I just kind of was trying to not to get so much in my head about it. I mean, these things happen. I mean, people are born and people die, but in my little world, it's not as cut and dry as that. I still take Marty everywhere I go. I wear his dog tags, and then his ashes are in a cross that I wear around my neck. Just like my mom's ashes are in a cross that I wear around my neck. So I can keep them close to my heart. And I have to tell you, when I was in that helicopter, I had a firm grip on my crosses. And I was talking to him, and the paramedics were like, what? I'm like, I'm talking to my mom, I'm talking to my husband. They were like, okay, crazy lady. And then also at the same time, I get to wear this damn thing for 30 days. Excuse me. The reason for that is I have a low heart rate, like between 35 and 50, when apparently your heart rate should be like 90. So we got to wear this and, record all the events you have and stuff. I thought, well, this is great. I have to do that all this while I'm in the hospital. But, I was watching over like one of my old videos that I'd done, and I was like, just kind of dumbfounded about what was going on at that time, because this was pre my surgery, so my surgery was 3 years ago, and I was thinking to myself, how much life has changed, even in the past year. How much life has changed for me. I mean, I have done things that have been out of my comfort zone. I have made decisions where people didn't absolutely agree with the choices that I made, but I am trying to do what's best for me and my mental health and my body. And that doesn't necessarily, bode well, I think, with everyone. But I mean, really, if you think about it, I mean, I'm just trying to make it one day at a time. And my support system, my family and friends have been amazing. And they know, that every day for me is a struggle. And I feel like crap and I look like crap. And I know things are going to get better. I know things are going to get better. Just sometimes you got to let yourself go through it, And I definitely have been letting myself go through it. I had wrote out a goal sheet thing for where I want to see myself 3 months, 6 months, 9 months, a year. Some of the things are right on trend, going, the way that I was wanting them to go. Other things have happened sooner than I had anticipated, but I'm happy with what is going on in my life right now, except all the health stuff. I mean, I'm dating a great guy. A couple of friends thought it was a little bit too soon, but I was like, well, not really. It's different when it'd be one thing if I was 20, but I'm not. I lose my confidence sometimes, but for the most part, I'm confident. I know what I want my life to look like, and it may be hard sometimes, but generally speaking, I have some resolves. So I was able to get all my teeth taken out. Probably why I'm covering my face, because I'm a little subconscious about that. And then I'm going to be able to get my dentures in a month and a half. Yeah, about a month and a half. And I'm excited for that. And I really I realized early this morning, I was rewatching an old video that Marty and I did, one of my unboxing videos where he was trying to get me to wanted me to do try on tutorials at the end of it. And I was just watching my interaction with him, and it got me to thinking, what would he think about the choices that I've made lately? And I know what he would think. He would think that it might not be a choice for everyone, but if it was right for me, then he's glad I did it. The choice I'm talking about is choosing to smoke or use the CBD marijuana gummies to help with my pain. I mean, that wasn't something that Marty and we discussed at one point, but this was way before, it was legalized here in Missouri. So medical marijuana is legal in Missouri. Ow, fudge, that hurt. And they're putting on the ballot to try to get it passed recreationally, but for right now, it's you have to have a medical ID card, so that's what we do. But We did once talk about this because I was on a really high dose of morphine, and I really just hate taking pills. I really do. But I know that they're necessary sometimes. But when you have to take pain medications for over 20 years, you have to basically set a timer, set a clock, set an alarm to remind you to take pill A, B, and C at this time. And pill, yeah, it does not thrill me. But I know that I am doing the very best I can. And again, a doctor that wants me to do a PET scan because they think there's some type of mass in my lung. That wasn't found here, that was found in Springfield. And this will be the second set of PET scans I've had done. I had one done right after my gastric bypass surgery 3 years ago.